Is Ambassador Parthasarathy. Also with us is my colleague Siddhant Sibbal. I'll be coming to Siddhant in just a bit, but before that, Ambassador Parthasarathy, some important points there being made by the Prime Minister, even as most leaders here highlighted the fact that these regional economies will be affected in a massive way going forward if clear action is not taken.
Well, yes, and I think he did say that we need to get together to brainstorm on how we should do ahead. Look, there are two consequences of this. One is immediate. How do you deal and overcome the health hazards? Second is, let's face it, especially for countries like Maldives and for Sri Lanka, they are tourism-dominated economies. Their economies are badly hit. How do you help them getting ahead with their economic growth? So the dimensions are very clear. I mean, that on what needs to be done. India believes that you can have a group of people to discuss it. Pakistan would like, of course, the SAARC Secretariat, but that's a matter of detail. We can work it out. But I think we should be very, very clear that there is an appreciation of the Indian initiative, of the Prime Minister's initiative, that in a crucial sort of experience which even we are going through with 107 people affected, we are consulting first and foremost our immediate neighbors.
Yes.
So in diplomatic terms, that's going to be appreciated internationally. How we carry this forward really is what is important. I think the Pakistanis would be very reluctant to have an aid just given by India. But I don't think that should come in the way. Treat it as a SAARC initiative, and we will decide it with consultation with others who need those $10 million to help out. But as I see it, this is also a signal to our immediate neighbors. If you have a problem, we are there.
Yeah, absolutely.
Whether we do it regionally with Pakistan's cooperation or not, we intend to do it.
Yes.
And it is a reassurance to our neighbors. If any one country chooses to take another path, that's their choice. But the option is open that yes, we are willing to use SAARC, which because of terrorism had become defunct, and also other dramas like asking for China to be made a member. It's not in South Asia. This is important. So the options are open, and the government has done well to keep it open. And if everybody goes along, fine. But otherwise, we set up our own setup, ICMR, and deal with their counterparts.
Absolutely. In fact, you made some two very important points. We'll come to that, Ambassador Parthasarathy, the Pakistan angle to it, and of course not being represented by the Prime Minister. We'll talk about this. I'll just go back to my colleagues Siddhant Sibbal and Mustafa Kazemi, who is joining us from Kabul. Siddhant, now this of course is the starting point for this dialogue between the regional leaders, which will obviously then go into back-channel communication, ministerial level dialogues possibly, and creation of funds and other such aspects that were touched upon in this video conference today.
Well, yes, Bhairavi, significant development, significant conference, and the clear intent from New Delhi was when it comes to global or regional challenges, it requires global solutions or regional solutions. Two key things which India has proposed, which is the fund, the emergency fund, in which India will be giving $10 million, and India's rapid response teams to deal with this crisis will be at the disposal of any country in the region who would like to utilize them. Significant given the fact that India emerging as a leader when it comes to this crisis, the crisis that is spreading very, very fast, but also a message of revival of SAARC that was lying defunct since 2016 because of the issue of cross-border terrorism emanating from Pakistan. But we also saw proposals coming from other leaders as well. But the key feature, if we look at all the speeches of all the leaders, one thing they highlighted was the impact on the economy, especially tourism sector for countries like Maldives, for Sri Lanka, and of course Bhutan also highlighted how their limited resources can be majorly impacted because of this crisis. But it's perhaps for the first time that regional leaders or of any part of the world have come together in a transparent manner online in front of the public. It's just not people from the region, in the South Asian region, watching carefully, weighing each and every word, but across the globe we do expect people clearly watching how India has emerged as a leader in this crisis. We also know that the Indian Prime Minister has proposed a G20 link-up as well. The Australian Prime Minister today lauded that initiative. In fact, Australia is the first country to publicly come out and laud this initiative, but a final decision will be taken by Saudi Arabia, which is the chair of G20, and will take the final call if this meeting has to happen. But by and large, a significant development for South Asia.
Much for that. Also joining me is Mustafa Kazemi at this point. And Mustafa, well, Ashraf Ghani made some very important points about how the Afghan economy has been suffering, and if there is a further spread of COVID-19, it's only going to get worse. He had a proposal, he had 5 proposals, including cooperation on telemedicine, as well as some help from India when it came to distant learning as well. Take us through some of the thoughts that Ashraf Ghani had on a closer cooperation between Afghanistan and the rest of the subcontinent.
Thank you, President Ashraf Ghani pointed out some of the very small things that we are facing as challenges here in Afghanistan. He already, before today's video conference, he had allocated $25 million for an emergency fund to be used inside Afghanistan in case the outbreak of this epidemic, this pandemic, goes beyond control. He has pretty much taken all the measures as they have been sending out advisories, taking steps necessary. And from the talks happened during the video call, the conference, my take is that every country, and especially Afghanistan, they have taken their most needed steps and precautions already. But the fact that India has stepped up to emerge as a leader and take the fight against COVID-19 to another level is something that we are facing new, and is something actually gladiating for the Afghan government, health officials, and the people. Before this, the Afghan people that we have interviewed, most of them, the residents of Kabul and other provinces, did not say that they are looking forward to health ministry being useful and doing actually serious works, taking precautions and other steps. But now I believe if we talk to the people again, it would be a matter of change in their opinion, that India is now stepping up and that Afghanistan will definitely prevail in fighting against COVID-19. President Ghani has taken the necessary steps, and now that Prime Minister Modi stepped in and offered the $10 million aid, as well as the medical rapid response teams, this is something that we look forward to, and that the situation in Afghanistan may get better and go onto a downside instead of going upside. And with the economic dependability of Afghanistan, with Iran and Pakistan, in case these two borders come to a closing, and we did expect actually the border with Pakistan to be closed today, March 15th, to stop the coming people from there and to prevent further outbreak. This would be a help for us. As President Ghani mentioned, there will be a shortage of medicine, food, and other basic supplies if the fight against COVID-19 is not taken seriously and not enough budget and resources are allocated to it. Back to you.
Right, Mustafa. Thanks very much indeed for that. I just want to go back, Ambassador Parthasarathy, to, of course, 2 things that have emerged from this. One, of course, India taking the lead, being ahead of the curve when it comes to stopping the virus from spreading even internally. We've seen, how it spread in Europe and the United States. And second, of course, the reaction of Pakistan, the Prime Minister not being present for this important meeting, which goes beyond politics. This is about health. This is about, how this virus spreads. And the fact that the doctor, the special health advisor, Pakistani health advisor who was there at the conference, saying that we want to host the next health conference, the next SAARC health conference, and we would want China to be part of that as well, hinting towards that as well.
Oh, well, first of all, I think the other proposal was sensible, that we have SAARC members in together with the Shanghai Cooperation Organization. Yeah. So the two linking together, that is
cooperation works.
That is sensible between regional cooperation organizations. The important thing we have to bear in mind with regard to Afghanistan is two. Immediate.
Yeah.
One is the
open border.
Is the open border. Don't forget, after what has happened in China, the most serious impact of this has been felt in our neighborhood, in Iran.
Yes.
Iran shares a border with Afghanistan.
Yeah.
So I think that portion of it we should be able to cooperate with Afghanistan, either directly or through SAARC. Equally, he mentioned, President Ghani mentioned distant education.
Yes.
Now, even in Africa, we are using television services and our satellites, and we have a SAARC satellite to provide information. I think using that SAARC satellite to share cooperative information on this would be a good thought, because especially for education now, in the case of Iran, they are deeply hurt if resources are not forthcoming.
As is the common pool of medicines that Ashraf Ghani was talking about.
I mean, we're doing pretty well in our pharmaceuticals. We're a net exporter. So I think, yes, what emerged from the Afghans was very useful. What is really can be used to, as I said, the SAARC satellite to be used wherever necessary, and also to the benefit of Afghanistan in this case, and also the fact that they also need to be careful, because, and it will affect us also. They're located next to a country very hard hit.
And they did mention the fact that closing the border was a challenge because of the connectivity issues between Iran and Afghanistan, and of course Pakistan as well. Mustafa there pointing out that they were thinking of shutting that border with Pakistan as well. Going back to the point that Sheikh Hasina made and others as well, Rajapaksa made, about a long-term strategy that was needed to be devised, maybe a ministerial level dialogue going ahead, because the ripple effect of this disease will be felt for the months to come.
I think yes, we can have a ministerial meeting, or and since it's the idea of the Sheikh Hasina, we encourage that moves forward, and that can certainly include first at an official level with experts, and then the ministers deciding what the governments can do. So I think yes. So you have got from this conference some very specific suggestions on reviving some form of cooperation which is mutually beneficial within South Asia, and at the same time we can address specific issues like Bangladesh. Maldives has also hinted that it needs such assistance. So whether we channel it through SAARC or bilaterally, that's a matter of detail. But this conference has produced that result.
Right. And, as I was pointing out, that the Prime Minister, of course, has taken a lead in this, and as my colleagues are also pointing out, that this has sort of, in a way, devised an idea for the rest of the world. The G20 is thinking of something on these lines as well, a video conference, and the G7 has also proposed something like this, that we must all come together and sit together and devise a plan, because Europe's been affected very badly as well. But in terms of expertise and preparation, health preparation, do you think it's enough for South Asia? I mean, we're extending our help to the rest of the region, but wouldn't that be a shortfall for ourselves within the country?
No, I think really, if you are the biggest country here, you have a big responsibility. What they will require is not huge number of our personnel, but more than that, training on their personnel, and if possible, supply of equipment.
Right.
Whether we do that bilaterally, regionally, that's a different matter. Whether we do it from the $10 million fund, that's a different matter. Because here the idea should be to get their people to be able to stand on their own feet. And that will be something which is greatly appreciated. And I think even we would be well advised, even in the case of Maldives, which is far away. because an island state can be hit very hard. And they are losing on, and where we should help South Asia economically would be at G20. Because these are small, with a specific suggestion to G20 of assistance to these small island countries.
In fact, the Maldives also pointed out that their economy and the tourism economy is affected very badly because most of their tourists come from Italy and China. Siddhant is also with us, and Siddhant, this is something that the Prime Minister also mentioned in his last comments, saying that we can have our experts brainstorm in the economic fallout of this COVID-19, not just the health aspects of it, and going forward we will be looking into this because this is clearly not the last epidemic that we will possibly see.
Well, yes, the leaders are also talking about the future strategies as well, whether it is any future epidemics or crisis or the economic fallout, because the economic fallout is something that is on the mind of all the leaders, not only regional leaders but global leaders as well. In fact, the Australian Prime Minister, when he was lauding the Indian Prime Minister for taking the G20 initiative, talked about how not only the G20 leaders should be linked up, but also how there should be a meeting of the G20 finance ministers. Remember, the last time G20 finance minister met majorly, they now meet annually, of course. For the first time when they meet because of some emergency was way back in 2008 after the financial crisis. Back then G20 finance ministers met, then it later on evolved into G20 grouping. But talking about the regional development, the SAARC meeting which has happened, we saw the leaders speaking specifically. If we look at the speeches made by smaller countries like Bhutan, the Bhutanese Prime Minister, who is in fact a surgeon as well, talked at length about the economic impact and said that it's time that the differences should be kept aside because it's a time of crisis, and how the leaders should come together to chalk out a common strategy. And India, of course, walking the talk, coming out with various proposals, whether it is the emergency fund, whether it's a rapid response team or other services which New Delhi, as a major country in the region, as the biggest country in the region, can provide. In fact, New Delhi had already put in place measures to help the nationals of other South Asian countries. India has evacuated many nationals of Bangladesh, of Nepal, of Sri Lanka and Maldives. In fact, the Bangladeshi Prime Minister thanked the Indian Prime Minister in her starting comments for evacuating 23 Bangladeshis from Wuhan, which is of course the epicenter of the crisis, on 27th of February. And we saw yesterday they left for their country after a 14-day quarantine period. And they, of course, during their stay made a lot of comments, which of course we can see on the social media as well, where they have thanked India and said that it seems that India is a second country for them. So clearly India is walking the talk, whether it's medicine providing to Maldives or whether it is technical support to Bhutan and Afghanistan.
Right, absolutely. Siddhant, Mustafa and Ambassador Partha Sarathy, thanks very much indeed for joining us this evening and sharing your thoughts.